Hello, everyone. This is Chris Frederick with the Collaborative Care Collective, and I'm here with one of the presenters and one of my mentors in lots of ways, Gregg Johnson. Welcome, Greg.
Well, thank you very much, Chris, for doing these interviews and for inviting me on.
Well, thank you. And why don't we get started by telling us a little bit about yourself, your bio a little bit, what you do?
Well, I'll try to keep it as short as possible, but since I've been a physical therapist now for 54 years, uh, there's quite a history there. But I'm a graduate of USC, University of Southern California, in 1972. I followed that with having a residency, a year-long residency in proprioceptive neuromuscular facilitation. uh, a, a technique, a system developed to treat neurological patients, but we have really evolved it into treating the orthopedic population also. And I spent 7 years there, uh, left there to open probably the first cash-based physical therapy practice in 1978. And started at that point with my wife, Vicki Johnson. She wasn't my wife at this point. The Institute of Physical Arts, which is a continuing education institute that we have now run since that point, since 1978, in which we offer continuing education courses for physical therapists worldwide. We have residency programs, fellowship programs, and we teach and work in several overseas countries. So that's kind of what is there. I am presently working in our private practice in Steamboat Springs, where we have a resident and a fellow presently on staff that we're working with.
Right.
And so
I know.
that's kind of the emphasis there.
Right. Just as for myself and other physical therapists who've been around for a while, pretty sure we've all heard of you and Vicky and what you do. And I'm from New York, and we heard about you at the hospital. A bunch of the staff were taking your courses back in this is 89, 90, early 90s. And you were all the Institute of Physical Art was all the rage. People coming back doing in-services about the courses they took with you too. And unfortunately, I never got to go over there. I got involved with some other mentorships. So otherwise I would have done that, but you're here with us, and I need to encourage physical therapists and physicians and allied health practitioners to come to this summit. This is about the Collaborative Care Collective Summit, our second one, and this is going to be June 27th, 2025 in Denver, Colorado. And we have a rich roster of speakers, presenters, and there's laboratories where you can actually do practical things as well. And it is for physicians, physical therapists, or as they say in Canada, physiotherapists and allied uh, healthcare practitioners. And so let's talk about how you got involved with C3. We'll call it C3. What is so special about C3 and the people involved with it?
Well, you know, Chris, probably the foundation is all of us are in this profession or all of the various different professions that are medical to care for human beings, to take care of patients, to serve our clients. And we in physical therapy have kind of surrounded the wagons around physical therapy. And most of the conferences we have are physical therapists who present in them. And we tend to look only within physical therapy. And the first real collaborative organization I joined is one that's called AAPMD. And it's a group of doctors and dentists who are interested in airways, how to gain health airways. So the minute that Gail Wetzler and Diane Lee talked to me about, and Vicki, about the development of this new collaborative care organization, uh, I was on board. And particularly since regenerative medicine is such a fascination to me, both Vicki and I have utilized stem cells uh, therapies for our knees and have had good successes. And so looking at that collaboration with physicians who were very interested in natural and more natural ways of being able to create healing is so important because we all know none of us know enough to truly serve the complex population. We need a team. And this group of individuals are some of the most talented in the country among physical therapists. Many of them are friends that I've known for many years, but also among the physicians. It is amazing to listen to their presentations and to recognize patients that they could help us serve.
I have to wholeheartedly agree. I hear too that, and I have personal experience observing some, like Brad Fullerton. I went to his practice. He spends so much more time doing the subjective, and the objective of the soap notes that we do. That is totally unusual. It does not exist in the system where you get 5 minutes mostly on the average, if not no
Yeah.
more than 15 minutes with a physician. And they're all trying to, there's a lot of good people out there. They have good hearts, but the system dictates, and they have to treat the diagnosis, not the person, as we all know.
And that is one of the greatest challenges of the medical profession right now is that we've really gone away from a system that used problem solving and
Right.
critical analysis of situations to where they're dependent upon test and upon algorithms and upon evidence-based practice. And in areas where the evidence base isn't there, many of them are just lost because they're not trained in problem solving. And that's to me what I see among this group of physicians, are a group of physicians just so dedicated to solve problems, to try something new if it might help. That's the way I've always practiced, and it's the way I so value and see in medical professionals who do that.
Well said. I keep hearing among the C3 presenters and those who put this together about this being the theme is the patient's story. It is patient-centered. Could you speak on that? What does that mean? Because that harkens to everything you said previously. It's about the patient, the person that we're so passionate about helping.
That was something that I say in many of my classes that I teach, and that is uh, oftentimes who we are, the practitioner, in that treatment room with that patient is more important than what we do. It really starts with us. So the patient's story really begins with us being interested in their story, in having compassion and empathy for them, for their journey, recognizing that their journey has brought them finally to us. And often what we see in our practice are patients who have failed in so many other areas, and they come to us for that final thing. And then the story is the important part because oftentimes it may take several visits to finally get down to understand the genesis of their problem, to really understand what has created their present symptoms so that you can better now develop strategies for being able to manage and to treat their problems.
So true. I mean, oftentimes when I know I have to spend enough time in the subjective with someone with complex pain, for instance, I have spent as much as 30 minutes. And often I hear many of us with the C3 group spend a lot of time really to understand what's going on. And oftentimes we hear from them, you're the first person that sat down with me to really get to understand what's going on.
No question. No question. And I do think that that's again that personal touch that another human being can make to another. We may have evolved into such a digital age, but we as individual human beings really want to be understood, to be cared for, to be accepted. And those are things that are so important for us as practitioners to be able to offer that individual.
What do you think about people who are in the system and they like what they hear about us talking about how actually you practice, how your wife practice, how the other presenters actually practice? It almost sounds like a dream. How is that even possible to practice in that way? Can you make a few comments about what someone in the system could learn? I think rubbing shoulders with people like you and the other presenters, just being in the physical presence, you can't do that online, right? On an
No.
online conference, of course. Can you just speak on that a little bit?
Well, I think, Chris, that it really begins first with hope. So many of the individuals you and I see enter into us with just lack of hope. They have really been defeated by the lack of care that they have received from others, with the lack of results, the lack of feeling like they're an individual that matters. And so, first of all, we have to be purveyors of hope. And if that individual can just in that first interaction with us leave with hope, it changes them from their sympathetic driven system to more of a parasympathetic given system. They start now being able to be in a healing process. So I'd say that first phase is really hope, and that is part of that whole journey that I think with it we need to offer. But then it really is that ability to understand that person, to ask the questions, to understand the genesis of their problem, and then being able to offer very selective, for in our cases physical therapists, manual therapy, exercise, training, advice, pain science information, clues to be able to further give that individual the tools to start their rehabilitation, to start their journey
Well,
back to
speaking,
being themselves, back to meeting their goals.
indeed. Well, speaking of hope, what do we hope to hear from you during this summit? You and Vicky.
That was a good transition to that question. Uh, this time, what I'm selected to work on is first a evaluation system that I'm going to present for the aspect of the shoulder.
Right.
And
Great.
it's one that was initially started and developed by Herman Cabot, the developer of PNF.
Right.
And it is one in which we're going to really look to see if we can identify cervicogenic inhibition that's that's either as a result of someone's shoulder problem or is contributing to that shoulder problem. So the very first component I'm going to be showing is how we can assess that and then how we treat it to facilitate those core muscles and to facilitate the muscles around the shoulder girdle and arm region. And then I'm going to present on 6 basic accessory motions in the glenohumeral joint that can be evaluated, return that and treat it to return that joint to a more efficient state.
Oh, I can't wait. Whetting my appetite and all of us listening. Yeah, this summit last year, we did the low back and pelvis. This year, it's a cervical, thoracic, and shoulder. Isn't that true?
Yes,
And
I think the emphasis is on the shoulder, but you can't treat a shoulder without dealing with the rib cage underneath and the cervical spine above. I mean, it's just not something you can do. And one of your earlier questions about the medical profession or looking at it, one of the biggest challenges right now is many of the shoulder specialists in PT don't look at the thoracic spine to a great degree or the cervical spine. They are focusing just on the glenohumeral joint and the shoulder girdle.
got to treat the neighbors.
They're all, that is so true. And, you know, a lot of times it takes the full system to be able to understand it and look at it. And that's one of the things that we do a lot of and that I think Diane Leo really helped emphasize within the course, and Gail. You
Mhm.
know, I think that the systems approach to any problem is I think the only way that you can really true get full rehabilitation of an individual's problem.
I totally agree. Just a brief word about my own experience. I went from treating the locale, the part, the diagnosis, to the systems approach. And like all of us who had that radical change, it's like, oh, people are getting better now and quicker, more efficiently, and it stays. It doesn't come
Yeah,
back.
that is so true.
And to be in the company of all of us together helping each other because the body's still a mystery. There's so many things that we still don't know. We're always learning. And that's what I love about the C3 group is we all have open minds. We put the egos aside. I don't even really see egos in this group, actually.
I sure didn't this last conference. It was truly a very supportive environment, and I'd say for both you and I, and I love going to present, but I'm more excited about going to learn and to be with
Yeah.
everyone.
It's indeed a collaborative care collective. So go to collaborativecarecollective.com, those who are listening, to find out all the information about Gregg and Vicky Johnson, as well as the other speakers, the agenda, the courses, and you can register there too, of course. And on Monday, it's a 3-day conference, and on Monday we have a special dissection offered too by Laurie Nimitz. So it's really rich, and we do hope to see you there. So I'm going to conclude this wonderful interview. I'd love to ask you so many more questions, but that'll be for another time. If anyone wants to get in touch with you, Vicky, your practice, if you feel free to give them any contact information, either to get treated and also to get trained in your system.
Well, first of all, if you're a professional who'd be interested in learning more tools that we teach within the Institute of Physical Art, you could go to the instituteofphysicalart.com and look at our uh, 15 live courses that we offer, and we also have about 10 to 12 uh, on-demand courses that they can just take at their own leisure that's online. One of them is the vagus nerve course, in which I really go through how to treat the sympathetic and parasympathetic system. And then a three pressure systems course, in which we really look at how to improve posture through enhancing the pressure within the three different pressure systems. And we have some pain science lectures and others there that are valuable. So it's a manual therapy approach. To get a hold of me personally, you can get a hold of me at greg@ipafmt.com. Presently, I'm at Johnson Johnson Physical Therapy in Steamboat Springs, and we have patients coming in almost weekly from around the country to get intensive care. And we do similar things at our other IPA clinics in IPA Physio Orange, Dallas, and Portland and Manhattan. So there are other clinics that we use our tools in to be able to treat patients in those areas. So thank you for that
That's wonderful.
opportunity to share those things.
Thank you for sharing your wisdom and your inspiration for how you and Vicky go about, well, I've been treating people for half a century and educating, and it's wonderful to share your wisdom. It's an honor to be in your presence and to receive from you. And I look forward to presenting with you with my wife. And again, everyone, it's collaborativecarecollective.com, June 27th to 2025 in Denver, Colorado. Hope to see you there. Take care, everyone.
Thank you
Thank you.
very much, Chris.
You're welcome.